morning and welcome to the second of our Facebook Live series this month. I'm Deanna Reed, the Community Outreach Coordinator with Enloe Medical Center, and I'm here today with Jeff Zelenski, who is the manager of Enloe Medical Center's Outpatient Rehab Services. And we also have Jenny here with us, who is one of our prior patients who will be going through showing you a little bit of demonstrations on some stretches and some exercises a little bit later in the program. Our topic today is all about physical therapy and how it can help to ease joint pain for those of you who might be experiencing that at any given time. So we want to make sure to remind you all who are joining us live, please go ahead and post your comments and questions in the comments field. We're going to be keeping an eye on that throughout today's session and answering as many as we can throughout the program. And we also want to remind you that this is not intended to be medical advice. This is just some information we hope that you can learn from and take some good tips away. And then if you do have questions about your own unique situation, we want to encourage you to talk to your own healthcare professional about those concerns and find out what's best for you. So with that, Jeff, can you tell us a little bit about what is physical therapy and how can it help people who are experiencing joint pain?
Yep. That's a great question. Physical therapist, is a specialist that works with movement disorders. In our clinic, we see lots of different types of patients. So we see young, little folks to the elderly, and anywhere in between. We see young athletes to folks that have had surgeries for their hips, knees, spine, overuse syndrome, work injuries, a little bit of everything over here at Enloe.
Yeah, so it's not just for older people. I know a lot of times when we talk about joint replacement surgeries like we did last week with Dr. Cummings and Dr. Watson, we think it's more, the 50s, 60s plus people who are experiencing arthritis, but it can be for any ages, really.
That's correct,
Yeah. So can you tell us, for people, who are scheduled to have surgery, when do they start talking about physical therapy and how do they get connected with somebody here at your services?
That's a great question. Typically, when folks are scheduled for surgery, here at Enloe, most of our patients are recommended to go to what we call our joint effort class. And so with that, we start to educate what they're going to be going through. And with that, one of the most important things is the physical therapy. So we get started with some of those exercises actually before surgery. That can start in the class to kind of give them an overview, an idea of what they do. Sometimes patients and physicians will send patients to come to therapy before surgery and individualize some of those exercises or some of those stretches that need to help them have a best outcome that they can with surgery.
Mm-hmm. So with the joint effort class, then that would be preparing them for a lot beyond just the physical therapy when they're looking at surgery.
Absolutely, yeah. It's the physical therapist that's there. There's also nursing that's there, and we also touch upon occupational therapy as well.
Nice.
Yeah.
So when they come in, a patient comes in, they know that they're going to be having joint replacement surgery, and they come to see you for their first appointment. What does that look like? What would they expect?
Yeah. From a physical therapist, every patient that comes in, we see them as an individual. So even though someone may be scheduled for a joint replacement, we still look at all the specific things that could be causing some of the things that must be, some muscles might be tight, some muscles might be weak. The balancing the system is kind of the simple way of thinking it. We look at the foot all the way up to the knee, hip, spine, those things that may need the skilled hands of a physical therapist to help address some of those, to prepare for surgery and or after to kind of help with some of that imbalance in the system.
Mm-hmm.
Yeah.
Now last week we talked about how to, when they have the surgery and how quickly do they get back into a routine. So physical therapy is a really important part of that.
Mm-hmm.
So if somebody comes in, they have say a total joint replacement, a total hip replacement, how quickly do the physical therapists go in and meet with them and get them moving again?
Yeah, that's a great question. And when we teach the joint class or when I've done some local talks, one of the most important things to tell folks is to be prepared. The day of your surgery, we're going to come see you. We're nice people, we want to help, but it is one of those things that after surgery, knowing that we're going to get up and get you moving. We do it to tolerance, but we want to get them up and moving. One of the things that you'll hear from us therapists is motion is lotion. We want to get you up and moving. So that's with your mobility, how you're getting out of bed, how you're walking and moving, but then also exercises and range of motion to kind of get you going.
And we talked last week about managing pain. That's something that you work with the surgeons and the nursing staff to make sure people are comfortable.
That's right.
But also, how would people know, there's going to be some discomfort, of course, but how do they know, or how do you work with the individual to make sure that they're doing what they need to do to strengthen and get their range of motion, get their strength back, and you don't want to necessarily push through the pain, right?
Yeah, that's a great question. In the hospital, we work side by side with nursing and the physicians with pain management, so that a lot of times we'll try to have that side by side so they're pre-medicated so they can tolerate those things. When they see us in the outpatient clinic, we educate them on, we want motion occurring. So we're starting to get the joints moving, pumping out swelling, getting muscles turned back on. We want them to go to tolerance. So we have talks and education on it needs to be tolerable. I'd much rather have somebody that had surgery to go and do multiple times a day and go through range of motion instead of one time a day and they try to push through it.
Right.
That's one of the things that we see after surgery is folks will go and try to do too much, too fast, and then things get more inflamed, more irritated, while things were already inflamed and irritated after a joint. So.
Right. So we have, I think you shared with us off camera, like 30 plus physical therapists here at Enloe.
Yeah.
When somebody is referred to physical therapy, either whether surgery is a part of it or not, how would they go about selecting who the best therapist for them is?
That's a good question. I'm very fortunate here at Enloe. We do have a large staff. We just hired some more. 31 physical therapists here in the outpatient department. We have a wide variety of specialists here, which is unique. We have some folks that really specialize in our orthopedic realm, post-op surgical patients, and then we have some folks that help our neurological clients. So, and then we have some folks that work with our little ones. Right. So that whole spectrum. The great thing is patients have a choice. So they may have a prescription from a doctor, but they do have a choice and they get to go. So some patients do ask. They do ask a specific therapist that they can do that, but if not, we try to guide them to a group of therapists that kind of get working the best outcome.
Yeah, and for people in the hospital, I'm kind of backtracking on it because we had a question posted about, do you make direct contact with the patients the very day of their surgery, or is it they get to rest a little bit and then the next day you come in and start talking about that motion?
So that motion starts day one. So after surgery, after they've recovered and get back to your bed, yes, therapy orders get going.
And make sure the anesthesia wears
off.
off.
Working with nursing, and of course how the patient tolerates things, it's really important. But we want to see what they can do. Sometimes it's getting them out of bed and taking a couple steps, depending on how they do. But definitely after a joint surgery, we're going to be doing exercises and range of motion day one and getting them up moving day one.
Walking on those new joints.
Absolutely, we want to get them up and moving as tolerated for sure. Motion is lotion. If there's one thing they can remember us from therapy, we want to get them up moving, and they want it to be tolerable. So.
Right, because the more they keep moving, the more success they're going to have long term.
That helps to pump out some of that swelling that's there. So the contraction of muscles can help pump out some of that swelling, and it actually can start to stimulate some of those muscles. When we have those surgeries, the swelling can actually inhibit or turn off some of those muscles. So we want those muscles to get back and firing so we can feel more stable on our feet. We want to get the swelling out. Right. In the clinic too, we do some different things to help with swelling. We have some machines that help pump out some of the swelling with compression and cold, and with exercises. And with our hands too, sometimes we'll help get some of that swelling out.
Yeah, we talked about that too, the hands-on with a physical therapist. It's not just sitting there saying, okay, go do this. Now you're really engaging with the patients and feeling, making sure they're doing it in the right, positioning and what have you.
Physical therapy, I can tell you what they are not. They are not just a glorified cheerleader. Physical therapists really, all physical therapists are now at a doctoral level of physical therapy. So they have advanced training, but they use their hands. So as is appropriate, they do hands-on techniques, working on muscles and joints, and then exercise that's very specific. They don't come in and say, you had a surgery and this is what you're going to do. We may have a path that we go, but everybody is individualized.
Right, so you tailor those exercises to the individual.
Everything that we do goes towards the patient's goals. So our plan of care kind of goes towards the goals of what they want to get back to doing. So that could be from, I want to get back to up and down stairs, or community walking, or I'm a marathon runner, or anywhere in between. So.
Right, so it's important to have those conversations and really be open with your healthcare provider about what your goals are, so that they can make sure that they're helping you work towards that. Yeah. So here at the Outpatient Therapy Center, you kind of touched on some of the machines and things that help with different things, but I know there's a lot of resources here. I just saw yesterday or a couple days ago there's actually a pool. You do some pool therapy things. Do you want to share anything about that with our viewers today?
Yeah, we do here at the rehab. We do have an indoor heated pool. Is a great modality for anybody that definitely arthritis or joint pain. It's a great environment for them to exercise and unweight the joints, so it feels a lot less pressure on the joints and muscles. And the goal is that you can actually strengthen some of those muscles around your hip, knee, back, so you can then be able to perform better on land. We do have classes here, so when they finish traditional therapy services, we have a great program called ArthroSwim. So folks in the community come, and they come a couple days a week, and they do that. So exercise. We tell our patients, exercise is medicine, and we encourage you to take it every day. And it's one of those kind of fall in line with some of the national recommendations. But pool aquatic therapy is a wonderful thing. We can use it for some of our post-op young athletes that we need to take pressure off of those grafts. To the elderly that's arthritis ridden, and it's just hard to get them going. But it's a great modality for aquatic therapy. Everyone's different, but for those it's appropriate, it's a great avenue for sure.
Yeah, I thought it was really great that we have that resource here for people.
For sure.
So at this point, do you guys want to show us, I know you have a few stretches that can apply to anybody, those of us who are out there running and want to make sure we can keep doing that, and then those who are considering surgery.
So what we'll do is we'll show a few stretches and really think of some general stretches. We realize that every patient is different, so you maybe think, well, I can't do that because of X, Y, and Z, and that's okay. But these are general stretches that we can do, and this is really for our general population, and/or some of these we may do after our post-surgical patients. So we'll go through a couple of those stretches, and then we'll show you a couple of basic exercise we do for range of motion or strengthening. These are similar to the ones that we may do before surgery or right after a total knee replacement, like she had.
And thank you, Jen, for being here to do this for us and show us how it works.
So, like we tell everybody, we're going to do a couple exercises and want to make sure that it's very tolerable. You're not allowed to push through pain, okay? So don't go hurting yourself, okay? But remember that whole thing of motion is lotion. We want to kind of get things moving and want to tolerate. So the first thing is, let's go through some stretches. Let's have you lay on your back for me, okay? Now, there's different things out there in research to say, but one of the studies talk about how length of time. You could argue about how long, but there's some that say if you hold a stretch for 20 seconds, okay, then that's long enough to get a good stretch. So the first one we want to stretch is your hamstring, and that's the muscle on the back. A lot of times that will get tight after surgery. So once you put both your hands behind your knee for me, excellent. So what you're going to do is keep your leg right in this position, and I want you to gently straighten that leg up to the point that's tolerable, okay, right there, that's good. And so as you contract the muscle on the front, you get to stretch the muscle on the back, which is the hamstring. You're going to hold that for how long? 20 seconds, that's right. And then a lot of times we'll hold for 20 seconds, and then you can rest for the 20, and then you can get back and repeat. So if you do it one time, that'd be one set. Ideal would be do it 4 times, okay? And then if you were, ideally, you do it twice a day to get the optimal stretch out of that muscle, and then we come on down. How does that feel?
One thing that I want to share, it's amazing looking at this range of motion, because Janet had total knee surgery on that leg. here just in July. So
She had some
it's
great therapy.
amazing.
She
Great
did
physical
a great
therapy.
job. It was the patient. She did a great job. Okay, so the next one we want to do is a lot of times, again, this is a good general population as our hips get really tight. So this is a nice one to do in the same position. This is the one where I'm actually going to bring your leg up, put your heel on your knee. There you go. I want to put your hand on your knee on this one, and your other hand, let's go onto your lower leg. Excellent. You're going to bring that knee to your opposite shoulder, and you're going to gently bring it to that diagonal opposite shoulder, and then you can gently rotate it. Ooh, you feel that stretch in the buttocks there. So she's got a positive grimace test. See how she grimaced? She feels a good stretch. Again, it needs to be tolerable, and we hold that for a good 20 seconds there. Okay. Then a lot of times we'll have them rest after that same 20 seconds, and then you can repeat that. How long do we hold that stretch?
20 seconds.
That's right, good. And then we come on back down, and we can kind of repeat that a couple times. All right? So that's that one.
And these are good for really any.
Yeah, this could be used
active
for
in any
anyone.
way.
Yeah, and a lot of times we'll tell patients it can be almost diagnostic. If you try those and you don't feel a good muscle pull, then you probably don't need to do that. Okay, that's a nice general tip. The next one is muscles on the front of our hip. Our hip flexors a lot of times will get tight.
Right.
So this is a nice one. Once you scoot a little bit over to the mat or the bed, we're going to stretch the front of this side, this left side, the hip flexors. With your right knee, bring your knee up towards your chest, both hands there. Excellent. This leg, I want you to drop this right off. Good. And let gravity take that. So as she holds that knee up, the front of her hip flexors, are stretching out. So we're trying to lengthen them out. Those are ones that when they get really tight, it's hard to get a full stride when you're walking, doing your walking or activities up on your feet there. Again, we'll hold for a good 20 seconds. The idea we would do that, rest in between and do that 4 times, right? That'd be the most ideal.
And then you would do 4 times on one side and then 4 times on the other side.
Yep. And then bring that leg back up. Excellent. Last one, stretching wise, let's have you roll onto your right side. Sometimes we can use different props like towels or straps, yoga straps, anything to help us give a little bit longer grip here. This one, we're going to put this right around her heel, and she's going to reach back behind her. This one, we're stretching out our quadricep muscle right on the front very specifically. As I bend that knee up, we get the stretch on the quad, and then as she brings it back behind, she's going to feel more of a stretch. Okay? Does that feel okay?
Uh-huh.
Good. So this one, we're going to go ahead and hold this one for 20 seconds too. Okay, we want everything to be equal. And the idea is to keep that nice and straight. Sometimes you could have somebody at home help that, to kind of keep that up in that position, or sometimes we can put a towel under there to kind of keep in a good position. Does that feel okay?
Yeah.
Wonderful. All right, good. Let's roll back onto your back. Excellent.
Now everybody at home, wonder, are you out there stretching and getting all these muscles loosened up? Is it inspiring?
All right, so those are some good general stretches that again could be, like we could use these after surgery or pre-surgery or someone that you're not having surgery, okay? So these are a couple exercises that we commonly will do for our total knee folks, like in the class that we talked about. This is some general ones. The first one, we're going to have you straighten this leg out. So we're going to exercise on this leg. The first one is nice and simple, is with an ankle pump. We're going to teach them to actively move their ankle up and then all the way down. Okay, and let's do that 10 times. And as I do that, the reason we do that, you see how the muscles are working on our calf muscles?
Yeah.
A lot of times, when we've had surgery, and we may not put the weight on our right away, we want to get the blood pumping right away. So using those muscles to pump the fluid kind of keeps us nice and safe, keeps the blood pumping afterwards, keeps us nice and safe.
Does that help kind of with the inflammation you were
Helps
talking
with
about
inflammation, and you want to avoid everything you can. You don't want to have complications after, and so as we do those, then we don't have to worry about those bad things.
Nice.
So that's the first one, okay? The second one, as we kind of move our way up, is the quadricep is the muscle up here. So Janet, what I want you to do is, your leg is nice and straight. I want you to have your toe up, and this muscle right here, I want you to tighten up that muscle and kind of push down to the ground. So as we do that, we're working on our quadricep, this muscle on the front of our thigh. attaches all the way up here. And we're gonna hold that for a good 5 seconds and then relax, okay? Good, don't hold your breath. Good, you rest for 5, and then we do it again. Toe up, tighten up that leg muscle, excellent. You're pushing that leg down nice and straight. You're not holding your breath, good.
Is this what they call isometric exercises?
You're right, this is an isometric exercise. That's a good one.
Yeah, I'm breathing through.
That's right,
They
keep
always
breathing.
remind us.
So you can sing or count or whatever to make sure you don't hold your breath. So we're gonna do the next isometric, kind of going up the whole leg. The next one is the buttocks, okay? So the next one, this is a hard one to see on camera, but both sides of her buttocks, I want you to kind of squeeze them together. Tight, 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 tight. Okay, good. You squeeze nice and tight. Hold for 5 seconds and then relax. Okay, a lot of times.
So what is that one helping, Jeff?
Yeah, again, our gluteus maximus, the muscle on the back side of our body, helps to contract those muscles. Again, you want the blood pumping. So think about it, when you're up in bed and you're recovering from surgery, those muscles just are not moving like they normally do when we're walking. Yeah, so we want to get those exercises moving. So definitely after surgery, you got to keep those things moving. And it's a nice, say if I haven't had surgery, but it's hard to get up and do some of those, these are some nice gentle exercises that again would be something that would be positive to kind of get the blood pumping. And think of that motion as lotion. We want to keep things going, okay?
So maybe for people at home when they wake up in the morning before they
Absolutely.
just jump out of bed, maybe these are some good
Absolutely.
things to do.
That's right. I just so happen to have this fancy bolster here. Let's put both your legs up there.
Just for you guys.
So this is a nice position. Again, now this is an active exercise that we start with. Down the road we can make this and put weight on this and make it more strengthening. But this is a gentle, active range of motion, kind of gently strengthening the quadricep muscles after our total knee and before. We want to get that muscle working. So this exercise, I want you to pull your toe up. I want you to straighten this leg up. Keep it as straight as you can. Good. Hold. 1, 2, 3, 4, 5, and then lower back down nice and slow. Okay. Now let's keep doing. Let's do 10 times. So as she does that, that muscle contracts. Good. And then as she lowers it down, the muscle works both directions. So not only bringing it up, the muscle works, but then as we lower it down, it still works.
And that's engaging the joint too, where she
Yeah,
had the surgery.
we're strengthening the muscles around there that help stabilize the joint. That we can make it tougher as we progress, that we can put an ankle weight on there. In the clinic or at home, we can do those things, okay?
But you wouldn't want to just do that on your own. That's something you do with the guidance of
Yeah,
the
it's one of those
physical
things that
therapist.
we start with. We want to make sure you're doing it correctly. After they get the hang of it, yeah, we can have them do it at home, some of the basic version.
Right.
We want to make sure that they could do some of that at home. So when they leave the hospital, we do want them to be comfortable and independent with a basic understanding of some
routine.
Yeah, some routine. Yeah. All right, we have that one. The other one, I'm going to take this out from underneath you. There you go. Keep your knees bent there. One of the ones that we do after our knee, and again, this could be done, we do it right after surgery. Lift your foot up, just this one. But also, if you haven't had surgery and your joints are really stiff, or in the morning when you wake up, having your knee sliding up and down really is a great exercise to kind of keep that motion as lotion. Slide that, Jenna, I want you to slide that leg out and then bend it back up. So we are trying to go through that knee in its full range of motion as she's using her muscles to do so. All right, so again, we talked about pumping out the swelling, right? Activating the muscles. Good. You can put a sheet or a towel, those different things. But that's a good one that we will often do.
So if somebody's at home and they're struggling with that, they use that towel and help pull.
They can help them, sure.
Knee
Yep,
moving?
yep. They can actively or assist it with the active assistive for sure. One last one we want to show here on your back position. We're going to work on this hip a little bit. Those hip muscles we need when we get up and we do walking activities right after surgery. So this one, I'm going to have you, Janet, straighten this leg out for me. And this one, we've worked on getting this leg nice and straight again. So to start this exercise, I want to keep your muscle on the front of the quad nice and tight, so tighten it up. Toe is going to be up. And now what you're going to do is you're going to slide your leg out to the side, keeping your toe up to the ceiling, and then sliding in. Good. We're going to slide it out. And let's do that 100 times as we talk to the camera.
That's a lot of sliding.
So I'm kidding. We'll stop at 10. But the idea is we're working the muscles on the outside of the hip. Okay, so we're actively working on. So this is a nice starting position of working our hip strengthening. Okay?
Nice.
And sometimes after the surgery, the muscles really they hibernate, they turn off. So right after surgery, we want to start turning those on and getting those muscles going again. Okay?
Now, do these
Excellent.
apply for patients both who've had knee surgery as well as hip surgery, or
Yeah,
is there
that's a good question.
variance?
Definitely all of our knees. Okay, all of our knees. Sometimes our hips are going to depend. There's different types of hip positions depending on their surgery and which way they went in, and it could be if they had a revision. So those are good ones that communicate with your surgeon. Sometimes those could tweak. Those could vary.
And with your physical therapist as your
Absolutely,
your
yep.
knees.
Yeah, the physical therapist will have orders from physician, and if it's not 100%, then we communicate and get those answers straightened out.
Okay.
Great job with those exercises.
That was awesome. So we didn't really talk about pain management so much. I don't know if you want to talk about that, because we keep encouraging people, letting them know you're coming right after surgery.
Yeah. So pain management from a physical therapy standpoint, I mean, in the hospital, we kind of alluded to that in the hospital, we work side by side with nursing and physicians to make sure that, sometimes they need pre-medication or whatever they need individually, working with anesthesia, nursing, doctors, to make sure that their therapy is tolerable. Okay?
Right.
In the outpatient clinic, same type of thing. They may have instructions with the physician about taking pain management or taking pain pills or what have you. Here in the hospital, there's different things that we do. We use ice, we use heat, we use different forms of electrical therapy to help with pain. We use taping. We use our Game Ready system, which is kind of vasodynamic. It helps to pump out some of the swelling. We use our hands to kind of help pump out some of that. So there's different types of things that we do to hopefully help with decreasing the pain to do that.
So is it the swelling that's causing a lot of the pain? Because you alluded to that several times.
Yeah, definitely there's kind of a myriad of things that can cause it. The swelling definitely post-operatively, right? That can be one of them. But also then the incision. So when you've had the surgery, the incision itself can be painful, and then the work that they've done down below. So there's things superficial that we can help with, but then also part of just the healing process for what they've done with the surgery.
Nice. Thank you. Jen, do you want to sit up? We're going to ask you a little bit, because that was amazing. I'm so impressed with how your range of motion is after you told me how recent your surgery's been. So Janet had total knee replacement surgery with Dr. Cummings, who we had talked to last week. And how's that going? How has the physical therapy helped you post-surgery?
Well, it's been tremendous. I am not convinced anybody could heal very well without it. Probably not true, but that's...
It's a big part, though.
It's a very big part, because personally, I don't think I would have known what I could do and what I couldn't do. Was I hurting myself or not by what I could do physically.
Right. So
a therapist helps to keep you on track, and when you are hurting, it's a good hurt. So it's been a wonderful experience for me. I would highly recommend it to anybody. Do your therapy even when it's not the most pleasant thing in the world.
Right.
So
that your therapist can help.
Absolutely.
Is it a good hurt, or do we need to
Yes.
adjust things a little bit?
And they, and they really keep good track of you. They don't overextend things when you're complaining. But,
they hold you accountable.
Yes, they
make
certainly
sure you're
do.
doing
Yes,
it.
yes.
Yeah.
30 lashes with a wet noodle if you don't do it right.
I don't think that's probably totally true.
No, it's been a good experience. I would not have recovered as well as I have without it, I'm sure.
Yeah, well, it's wonderful seeing how you're doing today.
Yes.
And I so appreciate you coming and
Yes.
showing us how this all works and sharing your story.
Thank you.
Yeah. So we're getting close to the end of our time here. So I don't know, is there anything else that either of you would like to add for our viewers at home, either people that just are out there and active, we want to make sure that they stay that way, or people who are having discussions with their physicians about, maybe an upcoming surgery.
Yeah. When I do talks, I'm biased because I love physical therapy. I've been doing this for 20 years. That one thing that we can tell folks is, physical therapy is an evolving science, and that physical therapy a lot of times can be help all types of folks. So I think sometimes we get patients all the time that come in that say, "Gosh, I didn't know physical therapy could do that." So it is one of those things that if you've sprains, strains, chronic pain, different types of things, physical therapy does have the tools at least to take a look and a lot of times help folks. The nice thing about here, and I know I'm biased working with Enloe this long, but we have just a great group of folks that the nice thing is if somebody's not getting you better, we have therapists that can consult with one another, and if not, we have a second pair of eyes that can really kind of get the job done. So that's one of those things that I think therapy can, at least is a nice conservative care that can help folks.
I guess that kind of raises another question, is when should somebody seek out physical therapy? I mean, a lot of us, especially as we get older, then we have random aches and pains, and do we just suck it up, or when is the right time to ask for that?
That's a great question. More and more, I mean, physical therapy, unfortunately, we do see a lot of folks that have been suffering for a long time.
You say, we're just getting old.
And we don't like that answer, and we don't buy into that. So we think physical therapy can help, sometimes immediately help an issue, and or can give you some tools, like we say, tools in your toolbox, to help decrease pain, improve your mobility, or give you some specific things to help yourself on a daily basis. And so I don't buy the notion of I'm just getting old, or I hurt and no one can help fix me. Well, we at least give it a best shot to try to help you with that. So, and physical therapy can, right now we still work with a physician order. As healthcare changes and things go, that may change. But any physician can, with an order, we can see folks and help them out right away.
So the first step would be talking to their primary care physician, explaining what they're experiencing, and then maybe asking if a referral is appropriate.
And one other thing is that, I know I'm a physical therapist, but we also have a great group of occupational therapists. So in this clinic, we have 4 occupational therapists, and they specialize from the little people, patients, to the elderly. And so they work with hands. We have folks that work on hand surgery or hand therapists. Then the folks that may have had orthopedic conditions, to have had a stroke, and then we have a couple speech therapists that are just top notch. So we have a well-rounded group of therapists, I think, that can help folks. So sometimes they need physical therapy, but sometimes it's occupational and speech to kind of help well-round their care.
It looks like we had another comment. Matt was online and says it's not just about pain too, right?
That's right.
There's a whole lot that goes into it.
Absolutely. Pain is sometimes a symptom. Our focus is function. So we want to get patients back to function. We obviously care about folks' pain, and we want to be respectful of that, but really our goal is that we want to get back to their functional level, or restoring their function of what they can get back to.
Yeah. I think we talked a little bit, it's, these exercises that you were showing, there's strength, there's mobility, there's range of motion, there's so many aspects that go into it, and it's really the total health of our joints and our bodies.
Yeah, for sure.
Yeah. All right, well, I really want to thank you guys both for being here. Thank you both. Hopefully there's more than 2 people out there, but thank you everyone who joined in today to watch and to learn something about how we can use physical therapy and exercises to ease your joint pain. We're excited to be able to share these things and hopefully make life just a little bit better. If you missed any part of today's discussion, then it is going to be available on our Facebook page under the videos tab, so feel free to go back and watch that and revisit some of the exercises if you want to refer to them. And if you have any questions, again, we encourage you to talk to your healthcare professional about your own individual feelings and issues and things you might be experiencing. And we thank you for joining us. So have a great day.